So from a health perspective, getting ready for back to school is going to look kind of similar to what we saw in the spring.
When we return next week, staff and students will be required to wear a mask. If they don't have one, we will provide one for them. Any additional personal protection equipment needed by schools will be provided. We have a pretty efficient and effective system in place to replenish needs at schools with a pretty quick turnaround. Hand sanitizer and hand washing stations will also be available throughout the schools. And our custodial staff has been hard at work this summer and will continue as school reopens to ensure that schools are cleaned and disinfected each evening. In addition, we have provided them with the disinfecting sprayers so they can hit those high contact surfaces throughout the day.
Our classrooms, as much as possible, will have the desk space 3 feet apart. They'll all be facing the same direction. Kids should have assigned seats. That will help with contact tracing and knowing who's been exposed. In cafeterias, we're encouraging the schools to make sure that kids have assigned seats so that with contact tracing, we can know specifically when children are exposed, and that helps to quarantine smaller numbers of kids. We're encouraging pods and those concepts where we can keep groups of kids together so we can limit the amount of people that have to quarantine. We're going to have a nurse in every school. So with our schools following these layered strategies, the intention is to help prevent entire classrooms from having to be quarantined at a time. And so again, unless every child in a classroom, they're all within 3 feet of each other, then we shouldn't anticipate having to have an entire classroom quarantine. We know COVID's out there. It's been in our city for a time, and we want to do the best we can to keep our kids in school. They always seem to rise up to the challenge. They did well last spring, and I don't anticipate anything different.